if you are a woman in your 40s and you have started feeling anxious in a way you really never did before, maybe you have racing thoughts at night or a low level sense of dread, or maybe full panic attacks that seem to come out of nowhere you've never had before, and you've been told it's just stress or burnout or a natural part of getting older, I want you to hear this. It might be your hormones, and there's a lot that can be done about it. I'm Dr. Susan Zink. I'm a board certified psychiatrist and the founder of Elemental Integrative Psychiatry in New Jersey. I have spent 17 years specializing in exactly this, the intersection of hormones and mental health in women. I trained at Georgetown for medical school and UC San Diego for my psychiatry residency, where I pursued a specialty elective in perinatal mental health and reproductive psychiatry, and I hold the perinatal mental health certification through Postpartum Support International. I have also published research on reproductive psychiatry topics, and I teach it to the next generation of psychiatrists at a residency program here in New Jersey. As a mother of 3 daughters, also, I have a personal investment in getting this right. I created this channel because the women I see in my practice are smart, high functioning, and have often spent years being dismissed by the medical system, and they deserve better information. So that's what we're going to do here. Today, we are starting with one of the most common things I hear from new patients, anxiety that got significantly worse in their 40s, often without an obvious reason. So I'm going to explain exactly what's happening and why it's so frequently missed, and what a thorough approach to evaluating and treating it looks like. So let me describe who I'm talking to because you'll know immediately if this is you. You are a woman who has not always been an anxious person, or maybe you've had a little bit of anxiety, but you've been able to manage it. You've managed a lot of hard things. Maybe you've gone to graduate school or law school or medical school, and now you're somewhere in your 30s and 40s and something shifted. Maybe it's a low hum of worry that never quite went away, or it was sudden, a panic attack that came out of nowhere while you were driving or just lying in bed, and that really scared you. You are suddenly waking up at 3 a.m. with your mind running. You feel on edge in situations that never really used to bother you. Sometimes you have weeks where you feel completely fine, and then weeks where you feel like you're barely holding it together, or you just don't feel like yourself and you can't really explain why. Maybe you've even gone to your doctor about it. You've started an antidepressant or an anti-anxiety medicine, and maybe that helps a little and it works sort of, but maybe it doesn't help as much as you expected or wanted, and something still feels off. So what you probably haven't been asked is whether any of this tracks with your cycle or how your symptoms have changed over the past few years in relation to your period, or what happened to your anxiety after pregnancies or around other hormonal fluctuations. And that missing piece, the hormonal context, is often why these women aren't getting fully better. And that's what we're going to talk about today. So here's the problem with the way anxiety is typically evaluated and treated. In standard psychiatric diagnosis, it's largely symptom based. You describe what you're feeling, how long you felt it, how much it's interfering with your life, and then you get a diagnosis. And that's not necessarily wrong, but it is incomplete sometimes, especially for women in midlife. So when a woman in her early to mid 40s comes in reporting new or worsened anxiety, the default is generalized anxiety disorder or panic disorder, depending on her presentation. The first line treatment for those is usually an antidepressant, like an SSRI or an SNRI, possibly some therapy. And for some women, that's sufficient. They feel better, and that can work. But for many women in perimenopause, treating anxiety without accounting for the hormonal context is incomplete. You might get some relief, but you're not addressing exactly what's driving the symptoms, and often you're left with other symptoms that aren't fully getting better, like middle of the night awakenings or brain fog or irritability. And the reason this gets missed is partly systemic. Our framework wasn't designed with hormonal contributions in mind, and partly because perimenopause itself is under-recognized. Most women and even physicians think of menopause as a single event, just the end of their period. But perimenopause, the transition leading up to that point, can last anywhere from 4 to 10 years, and it can start in the late 30s. So the hormonal fluctuations during that transition are significant, and their effects on the brain are real and measurable. So let me explain what's actually happening, because I think once you understand the mechanism, a lot of things start to make sense. Reproductive hormones like estrogen and progesterone are not just for reproduction. They play a significant role in how our brains regulate mood, thinking, sleep, and anxiety. So, estrogen specifically supports the serotonin and dopamine system. It helps with serotonin and dopamine production, receptor sensitivity, and it also interacts with norepinephrine, another neurotransmitter involved in the stress response. So, when estrogen levels are stable and adequate, it acts as kind of a buffer or a scaffolding, a natural stabilizer for your mood, your nervous system, your sleep, and your attention. During perimenopause, estrogen doesn't just kind of gradually decline, it fluctuates. It can spike and drop unpredictably. And that instability is actually more disruptive to your neurochemistry than a gradual, steady decline would be. Women are very sensitive to those fluctuations. Progesterone adds another layer. It has a metabolite called allopregnanolone, and allopregnanolone acts on GABA receptors in the brain, which are the same receptors targeted by many anti-anxiety medications like benzodiazepines. So, in other words, progesterone through this metabolite has a natural calming anti-anxiety effect. And as progesterone fluctuates and declines in perimenopause, that calming effect also diminishes. So, what you have is fluctuation and reduction in two of your brain's natural anxiety buffering, mood boosting systems. And this is happening at the same time, often before you even realize you're in a hormonal transition. So, this isn't stress or burnout. This is actually chemistry and biology changing in your brain and body. So, I want to give you some specific patterns to look for, because these are the things that often go unreported, either because women don't think they're relevant, or because no one has ever asked, or because it's not being recognized. So, the first is cycle related timing. If your anxiety is significantly worse in the second half of your cycle, that's called the luteal phase, when progesterone rises and then falls. And women who are sensitive to those hormonal shifts often feel it as increased anxiety, irritability, or emotional reactivity in that window. The second is sleep disruption, specifically waking in the early morning hours, often between 2 a.m. and 4 a.m. And often women will describe feeling really activated and anxious. And this is very common in perimenopause and is often related to the decline in progesterone and the increase in cortisol that can accompany hormonal changes. So it's different from falling asleep. That's more the difficulty falling asleep that can be more typical of generalized anxiety disorder or even depression. So, the third thing is variability. Women with hormonally driven anxiety often describe feeling completely normal for a week or two and then suddenly derailed. And that cyclical quality, the good stretches followed by the hard stretches, is a clinical clue. The fourth thing is a history of sensitivity to hormonal change. So, if your anxiety spiked postpartum, or your mood changed significantly on or off birth control, or if you felt really different during pregnancy, those data points matter, and they often point toward a nervous system that is particularly sensitive to hormonal fluctuation. So, what does a thorough evaluation involve? This is where I want to be direct about what good care actually looks like for this presentation, because I think many women have not experienced it. A thorough evaluation for anxiety in a perimenopausal woman should include a detailed reproductive history. When did your periods start changing? Have they started changing? Have your cycles gotten shorter or more irregular? What was your experience like postpartum? If you've had a baby, how do you respond to hormonal contraception if you've tried it? These aren't tangential questions, they are central to understanding the clinical picture. The history should also include cycle tracking information if possible. If you've noticed patterns in your symptoms, that data is genuinely useful. Even a rough sense of when in your cycle you feel worst helps narrow the picture. An evaluation should also take prior treatment response seriously. If you have tried an SSRI and had a partial response or no response, or a response that worked for a while and then stopped, that's helpful information. And it might mean the hormonal driver wasn't being addressed. An evaluation should also consider the full range of what's contributing: sleep, stress load, thyroid function, other vitamin and mineral levels, nutrition, exercise, lifestyle, social support, because these things interact with hormonal and mood regulation in ways that matter clinically too. What an evaluation should not do is apply a one size fits all treatment without any of that context. So, I'm going to give a little bit of a treatment overview, but I'm going to keep this section brief today because treatment deserves its own video or its own video series, and I'll go deeper into it in more videos. But I want to give you a sense of the landscape. So, for hormonally driven anxiety, the treatment toolkit is wider than most women have been offered. Medications like anti anxiety, antidepressant medications can still play a role. Integrative interventions are a real part of my practice. There are supplements with genuine evidence behind them for anxiety and hormonal mood symptoms, things like magnesium, certain B vitamins, vitamin D, and others depending on the individual. And these aren't replacements for treatment, but they can be supportive additions that a standard psychiatric appointment doesn't always have time to address. And then the big thing is that hormonal treatment is sometimes also a really important part of the picture. And understanding whether hormonal support is appropriate is something I factor into my evaluation and discuss with my patients. Lifestyle, including sleep, exercise, stress regulation, is really important and not just filler. These things interact directly with your nervous system, and optimizing them is part of treatment, not separate from it. The point is that the answer to hormonally driven anxiety is first to identify if it is hormonally driven, and rarely it's just to take a pill. It's more of a complete clinical picture and a more complete and comprehensive treatment plan. So, if what I've described today sounds familiar, the timeline, the patterns, the sense that something shifted and you haven't been able to get a satisfying explanation, I hope this gave you some language for it and some direction and clarity. This is exactly what I work on every day in my practice. If you're in New Jersey and you want to talk through your situation, the first step is a free 15-minute intro call with me directly. There's no commitment, just a conversation to see if what I offer is the right fit to help you. If you found this helpful, please subscribe to this channel because I am going to keep going deeper on all of this. And next week, I am going to talk about reproductive psychiatry as a specialty, what it is, why most women have never heard of it, and why that gap in awareness has real consequences for how women are treated. I'll see you then.